The amazing and talented Celine Dion, noted for her powerful and technically skilled vocals, has revealed that she has been diagnosed with stiff person syndrome, a rare neurological disorder that causes muscle stiffness and painful muscle spasms. While we're still learning about this rare condition, we now know this is what's been causing all of the spasms I've been having, the French-Canadian singer told her Instagram followers in an emotional video. Unfortunately, these spasms affect every aspect of my daily life, sometimes causing difficulties when I walk and not allowing me to use my vocal cords to sing the way I'm used to, she said. As a result of her condition, Dion is postponing several tour dates in Europe. Despite the sad news, Dion bravely made her condition known in order to spread awareness about the disorder. Hi, welcome to YouWannaWatch, and in this video, we're going to talk about the things to know about Celine Dion's stiff person syndrome. What is stiff person syndrome? Every day, we rely on our muscles to carry our coffee, type on our computers, and walk to the grocery store. But while it is uncommon, those muscles can sometimes rebel against us. Stiff person syndrome, or SPS, is an autoimmune and neurological disorder characterized by muscle rigidity and spasms in the torso and limbs. This extremely rare disease's cause is still unknown. However, scientists believe it is the result of an autoimmune reaction in which the body attacks nerve cells in the central nervous system that control muscle movement. Other autoimmune diseases such as type 1 diabetes, thyroiditis, vitiligo, and pernicious anemia are frequently associated with it. According to Richard Nowak, a neurologist at Yale Medicine, people with stiff person syndrome can run the spectrum from mild to severe, and a personalized approach to disease treatment is the best way to ensure a better outcome. The disorder is considered to be very rare, affecting 1 or 2 people in a million, with women more likely to have the disorder than men. 𝗔𝗶𝗵𝗂𝗶𝗶, a pain medicine specialist with the Cleveland Clinic in Ohio Today.com, that the stiff person syndrome is a very serious condition. He added that people can have difficulty with movement and difficulty with living their lives. What are the symptoms associated with stiff person syndrome? Stiffness in the torso and limbs, as well as violent muscle spasms, are the main symptoms of stiff person syndrome. Environmental stimuli such as loud noises or emotional stress can set them off. The muscle spasms can be so severe that the person collapses. When the stimulus is removed, the muscles gradually relax. People with stiff person syndrome may develop abnormal, often hunched over postures over time. Some people may experience difficulty walking and, in the long run, greater disability. Many people fall frequently because they lack the normal reflexes for catching themselves. This can result in severe injuries. People suffering from stiff person syndrome may be afraid to leave their homes because street noises, such as the sound of a car horn, can cause spasms and falls. People with stiff person syndrome are also more likely to experience depression and anxiety symptoms. This is due in part to the disease's unpredictability, but patients also have lower levels of the neurotransmitter GABA or gamma-aminobutyric acid, which regulates anxiety. Stiff person syndrome affects twice as many women as men, and most people begin to notice symptoms between the ages of 30 and 60. Stiff person syndrome symptoms frequently progress slowly and can result in disability. Stiff person syndrome can be fatal in some cases. Some people with the condition may also have the following autoimmune disorders: pernicious anemia, an autoimmune condition that leads to a lack of red blood cells; vitiligo, a condition where growing patches of skin lose their color; celiac disease, an autoimmune condition that involves the immune system reacting to gluten; and diabetes. Physical symptoms include stiffness and rigidity in the trunk muscles, difficulty turning and bending, rigidity in the upper and lower limbs, an atypical hunched posture, stiff gait and difficulty walking, painful muscle spasms, falls, exaggerated startle responses to stimuli such as noise or emotions. People with stiff person syndrome often develop mental symptoms due to anticipating spasms from stimuli and social and physical limitations. These include depression, anxiety, a fear of open spaces, phobias relating to certain tasks that may cause spasms. The condition can affect the facial muscles in the later stages of stiff person syndrome. Some people may experience severe, long-lasting spasms that necessitate the use of intravenous muscle relaxants. The condition can, in rare cases, affect the respiratory muscles. Who get stiff person syndrome? Stiff person syndrome is extremely rare. About 1 to 2 individuals per million have the condition. People typically develop symptoms of stiff person syndrome between the ages of 20 and 60 years. Females are twice as likely as males to develop stiff person syndrome, and symptoms typically appear in their 30s and 40s. And people with other autoimmune conditions may be at higher risk of stiff person syndrome. How is stiff person syndrome diagnosed? According to National Institute of Neurological Disorders and Stroke or NINDS, stiff person syndrome is frequently misdiagnosed as Parkinson's disease, multiple sclerosis, fibromyalgia, psychosomatic illness, or anxiety and phobia. A blood test that measures the level of glutamic acid decarboxylase or GAD antibodies can provide a definitive diagnosis. It can be difficult to diagnose stiff person syndrome. In general, stiff person syndrome is suspected based on specific symptoms. A thorough medical history and examination, as well as additional investigations such as blood tests and spinal fluid analysis, can help confirm the diagnosis. Your doctor will look for elevated levels of GAD antibodies during those tests. The majority of stiff person syndrome patients have elevated or higher levels of GAD antibodies. Antibody titers are important in the diagnosis of stiff person syndrome. A titer is a blood test that determines the presence and amount of antibodies in the blood. GAD titers can be up to 10 times higher than normal in diabetes, but in stiff person syndrome, the titers are very high or present in the spinal fluid. Electromyography, or EMG, is another technique for studying the electrical activity of skeletal muscles. The doctor will be looking for typical motor unit activity findings in stiff person syndrome patients. How is stiff person syndrome treated? According to Yale Medicine, stiff person syndrome has no known cure. When treating patients with this condition, doctors use medications such as sedatives, muscle relaxants, and steroids to relieve symptoms. Other immunotherapies, such as intravenous immunoglobulin and plasmapheresis, may be prescribed. Physical, occupational, and aquatic therapy are also beneficial to stiff person syndrome patients. While according to NINDS, several symptoms improve with oral diazepam, an anti-anxiety and muscle relaxant drug, or with muscle spasm-relieving drugs like baclofen or gabapentin. A study funded by the National Institute of Neurological Disorders and Stroke found that intravenous immunoglobulin or IVIG treatment can help people with stiff person syndrome reduce stiffness, sensitivity to noise, touch, and stress, as well as improve gait and balance. Immunoglobulins, a natural antibodies produced by the immune system, derived from thousands of healthy donors, are used in IVIG. We are nearing the end of our video, but before we proceed, we would like to ask you to please like and subscribe to our YouTube channel at www.youtube.com/c/YouWannaWatch2022 and follow us on our Facebook page at www.facebook.com/YouWannaWatch. Any support you provide us will help us provide you with more and better content. Okay, now back to the story. How much does it cost to treat stiff person syndrome? Stiff person syndrome is treated primarily with 𝗔𝗶𝗶𝗃 therapy and immunotherapy. Treatment with intravenous immunoglobulin has been approved for stiff person syndrome in recent years, and some patients use a self-infused application instead, according to the National Institute of Health. Most major insurance companies will cover treatment if a professional diagnosis is provided. According to the nonprofit Partnership to Fight Chronic Disease or PFCD, the annual cost of neurological conditions in the United States was $655 billion in 2020, including direct medical and non-medical costs as well as indirect costs from lost productivity and uncompensated caregiving hours. Living with stiff person syndrome. Physical therapy, in addition to medication, may be beneficial. This may aid in the improvement of muscle tone, posture, and range of motion. People with stiff person syndrome frequently develop mental and emotional symptoms in addition to physical symptoms, which can have a significant impact on their quality of life. Anxiety, depression, and fear of the outside world should all be treated and supported. Celine Dion diagnosed with stiff person syndrome. On December 8, 2022, the three-octave soprano and Titanic Oscar winner for Best Song Celine Dion revealed the shocking and devastating news via her Instagram page. She's been diagnosed with stiff person syndrome, an extremely rare and life-changing disease. She bravely revealed the news via her Instagram in a post that was captioned, "I've been dealing with problems with my health for a long time, and it's been really difficult for me to face these challenges and to talk about everything that I've been going through. It hurts me to tell you that I won't be ready to restart my tour in Europe in February." Following the diagnosis, she was forced to cancel her European tour, the 𝗂𝗁 World Tour, and has been rescheduled from spring 2023 to 2024. The singer revealed that the spasms are already interfering with her daily life. "While we're still learning about this rare condition, we now know this is what's been causing all of the spasms that I've been having," she said. "Unfortunately, these spasms affect every aspect of my daily life, sometimes causing difficulty walking and preventing me from using my vocal cords to sing the way I'm used to," she explained. Her revelation has grabbed many people's attention, spurring more than hundreds of thousands of Google searches for stiff person syndrome in the 24 hours since her announcement. Celine assured that she is working closely with her medical team and that she has a lot of support from her close family. This is the latest tragedy that the Canadian singer has had to deal with following the death of her husband in 2016. But my heart will go on. Singer said that while she misses her fans, her health is her focus right now. I'm working hard with my sports medicine therapist every day to build back my strength and my ability to perform again, she said. But I have to admit it's been a struggle. Thanking her fans for their support, she became emotional. All I know is singing, the Grammy winner said. While Celine's spring 2023 shows will be rescheduled for the following year, 8 summer 2023 shows have been canceled. According to 𝗔𝗯𝗶𝗶 𝗔𝗯𝗹𝗶, there are many muscles involved in singing, especially in front of a large audience, and these muscles are prone to spasm or tightening up, and it can affect the way Celine sings and performs. 𝗔𝗯𝗶 added that if these muscles are not working properly, it can make it very difficult. What do you think about Celine Dion? Are you saddened by the news? Did we miss anything that you think should have been included? Let us know your thoughts by writing a comment on this video. If you're interested in our other videos, just hover over the videos and just press play. Until next time, watchers, thank you for watching our video.